Retinal artery occlusion, cherry red macula, retinal vein occlusion, blood and thunder retina. Some pediatric cherry red maculas too. Remember Tay-Sachs disease and Niemann-Pick, but Niemann-Pick also has hepatomegaly. CKD or diabetes mellitus with proteinuria, first line is ACE inhibitor. Remember, angiotensin likes to constrict the efferent arteriole, which increases glomerular pressure, which increases glomerular filtration. So when you use an ACE inhibitor, you get vasodilation of the efferent arteriole, which reduces pressure over the glomerulus, which reduces proteinuria. So it's considered renoprotective. Best at lowering triglycerides is fibrates. Only want to use fibrates when the triglycerides are over 1,000. Also, hypertriglyceridemia associated as one of the causes of pancreatitis. Best at increasing HDL is niacin. But even though I say this, remember that first line for hyperlipidemia is statins. And remember that there's 4 people who get statins: those who have current atherosclerotic cardiovascular disease, anyone with coronary artery disease or peripheral vascular disease. The second is diabetics over 40 with the LDL over 70. The third is healthy people with the LDL of over 190. And the last person is a person who is over 40 with the ASCVD risk of greater than 7.5% with the LDL greater than 70. These are the 4 people who get statins. First line for cluster headache, remember, cluster headache is the person who has one-sided eye discharge, one-sided eye pain, described as very sharp, unilateral runny nose, and extremely sharp pain behind the eye. This is a cluster headache. The number 1 treatment is oxygen. Prophylaxis is a calcium channel blocker such as verapamil. Versus tension headache, which is bilateral and band-like. This is actually just musculoskeletal headache due to stiff neck or bad posture, and this is just treated supportively. Migraine headache is the unilateral pounding, can cause nausea and vomiting, can be debilitating, worsened with noise, can also have auras, which can be strange neurological deficits, sometimes can even present like a stroke, and that can be tricky, but the key here is to look at the age. If there's a young person with a bad headache and dysarthria or like hemiparesis that resolves, and they're like 20 years old, this is most likely a migraine with aura. And the migraines you want to treat if it's severe or refractory with sumatriptan, which is a serotonin agonist, or prophylax with beta blockers or TCA. Post-nasal drip, which can cause upper airway reactive syndrome, which is a post-nasal drip that causes a cough. First line is antihistamine. Someone who has allergic rhinitis though, which is just constantly runny nose due to allergies, the first line is intranasal steroids. Bloody stool plus fever. Next step is stool white blood cells. If the white blood cells are positive, the next step is stool culture. If negative, symptomatic treatment. If you suspect C. diff, next step is C. diff toxin. Bowel obstruction. Next best step, X-ray of the abdomen. Anything with an acute abdomen, you always do X-ray of the abdomen because it gives you more information, but most importantly, it rules out pneumoperitoneum, which presents with free air under the diaphragm, which is an indication for surgery. Irritable bowel syndrome, think of alternating constipation and diarrhea, and the kicker is it's alleviated with defecation. Interstitial cystitis, the patient has all the symptoms of UTI, dysuria, increased frequency, increased urgency, but the urinalysis is basically has no markers of a UTI and or the antibiotics did not work. This is interstitial cystitis, and the kicker is alleviated with urination. Disc herniation versus spinal stenosis. Position. With disc herniation, bending over hurts extending feels better. With spinal stenosis, extending feels worse and bending over feels better. Don't just think, oh, shooting pain down the legs, oh, slam dunk for disc herniation. No, make sure to confirm the positional changes and what makes it better or worse. Remember, someone with disc herniation, the best next step, symptomatic treatment such as physiotherapy and analgesics, and you don't do an MRI quite yet until later on, because a lot of times disc herniation symptoms will resolve if it stays for like 6 weeks, or if now they have scary neurologic deficits like incontinence or paralysis, then you do an MRI. But usually the correct answer for someone who has disc herniation is first recommend supportive treatment before the MRI. Indications for MRI of the spine is if you fear cauda equina syndrome, right, which is lower motor neuron deficits, right, hyporeflexia, flaccid paralysis, fasciculations, urinary incontinence, decreased anal sphincter tone, or like saddle anesthesia. Those are indications for an immediate MRI. Or someone who has epidural abscess due to seeding from an infection, that will also cause fever, point tenderness, and neurologic deficits. That's also an indication for an MRI of the spine. Versus metastatic back pain due to a cancer, that person will have point tenderness to the back, and it'll be back pain that is really bad, especially at night, that points towards metastatic cancer to the spine. The first line for that is an X-ray. And spine metastasis cancer, you want to treat with opioids and radiation if the opioids don't work. Osteoarthritis, the number one risk factor is obesity. So in most osteoarthritis vignettes, the person's BMI will be over 30, and it gets worsened with use throughout the day, versus rheumatoid arthritis, which is improved throughout the day. Treatment for osteoarthritis is analgesics and to lose weight. Osteoporosis, remember, DEXA scan happens at age 65. If it's less than -2.5, that's osteoporosis. And first line treatment is bisphosphonates, in addition to weight-bearing exercises plus vitamin D plus calcium supplementation. But the answer will be bisphosphonates. You can have open angle glaucoma or closed angle glaucoma, and it can be, the dangerous one is acute closed angle glaucoma. This presents with a rock hard eye with non-reactive pupils. The person will see halos. They'll have very painful red eye. And with angle closure glaucoma, remember that meiosis helps. Why? Because when you stretch out the iris, that opens up the trabecular meshwork, which allows for aqueous humor outflow. So you want to give any drug that would promote meiosis, such as pilocarpine, which is a muscarinic agonist, which promotes meiosis, in addition to beta blockers, which decrease aqueous humor production. Blepharitis is inflammation of the eyelid. It will present with crusting over the eyelids in the morning, usually in a kid. It's most likely caused by Staph aureus, and treatment is scrubbing the eye in the morning with warm water and a warm compress. Versus bacterial conjunctivitis, which is purulent discharge out of the eye. This is also caused by Staph aureus, but in this case, it needs to be treated with antibiotics. And think if there's pus, then you treat it with a macrolide such as erythromycin. First line treatment for obesity is lifestyle modification, but if that doesn't work, then second line is orlistat, which is a pancreatic lipase inhibitor. Also, what are some indications for bariatric surgery? If the BMI is greater than 40 or greater than 35 with comorbidities such as like debilitating osteoarthritis. So you have stress incontinence, overflow incontinence, and urge incontinence. So stress incontinence is associated with multiple pregnancies and older age, and this is due to the internal urethral sphincter falling below the pelvic diaphragm muscles. And so anytime they valsalva, like cough or sneeze, then that increases pressure over the bladder, but the internal urethral sphincter won't compress like it normally does, because usually it's above the diaphragm, so the bladder and the internal urethral sphincter both compress, so nothing happens. But in this case, the internal urethral sphincter will have less pressure versus the bladder, which causes leakage of urine. In this case, the Q-tip test will show urethral hypermobility, so the Q-tip angle changes a lot. And then also the first line treatment for this is Kegel exercises, and if that doesn't work, the second line treatment is a pessary, which is a plastic device which is inserted through the vagina, which helps hold the bladder up higher. And then the third line treatment is a mid-urethral sling. Versus urge incontinence, which is caused by sporadic spasming of the bladder, and then this person will have the urge to pee and they won't be able to control it because it comes out of nowhere. And then the treatment for this is bladder training exercises, and the second line is something that will relax the detrusor, such as oxybutynin, which is a muscarinic antagonist. And then there is the final one is overflow incontinence, which is also known as neurogenic bladder, which is seen in patients with severe diabetes with neuropathic complications, or people who have spinal cord injuries, or people who have had recent surgery and the anesthesia has stunned their bladder. And so basically the first line treatment for this is intermittent self-catheterization, and if that doesn't work, then the second line treatment would be bethanechol, which is a muscarinic agonist. And then treatment of alcoholics is naltrexone or acamprosate. Treatment of smoking cessation, first line treatment is nicotine gum and patch. And then other possible treatments are varenicline and bupropion. Varenicline is a partial nicotinic acetylcholine receptor agonist. Its famous side effect is suicidality, and bupropion is famous for its contraindication, which is it's contraindicated in people who have seizures, eating disorders, or alcoholics because it lowers the seizure threshold. Bupropion is also an antidepressant that's famous for not having the side effects of weight gain or sexual side effects. Colon cancer screening, start at age 50. Every 10 years, you stop at age 75. If you find a polyp, the worst is a villus adenoma, then you repeat the screen in 3 years. If someone in the family less than 60 had colon cancer, then you do it at age 40 or 10 years before the family member was diagnosed, whichever one comes first. Pap smears start at age 21, end at age 65, and happen every 3 years. HIV testing happens in anyone who's sexually active with between ages of 15 to 65. Mammograms start at 40 years old and happen every year. DEXA scans happen at 65 years old. AAA screening happens at 65 years old in any male who has ever smoked. Pneumovax vaccine happens at 60 years old as well. Zoster vaccine also happens at 60 years old. Lung cancer screening starts at 55 years old for anyone who's ever had a 30-pack year smoking history, who currently smokes, or who has quit within 15 years. Chlamydia and gonorrhea screening happens in all women less than 24 years old. Hepatitis A and B vaccines happen for men who have sex with men, IV drug users, people with hepatitis C, or chronic liver disease. Why? Because hepatitis A or B infection superimposed on pre-existing liver disease is catastrophic and can require liver transplant. Having a cold or fever is not a contraindication for getting a vaccine. Breastfeeding is okay if you have gotten a vaccine. Don't breastfeed if you have HIV, or if you're on chemotherapy, or if you're a drug user. All military and college people should get a meningococcal vaccine. Cephalosporins are lame. They can't treat listeria, atypical pneumonias, MRSA, or enterococcus. Metronidazole, get gap on the metro. Alright guys, and that wraps it up for high yield internal medicine. I hope this is really helpful for you and helps you succeed in your shelf exam or for your step 2 CK preparations. If you have any other ideas or if there's anything else you would like me to expand on or talk about, then please let me know in the comments below. And all the best in your studies, guys. Good luck.